Well, this afternoon, the Ghana Medical Association is asking government to reintroduce some restrictions in the wake of the resurgence of COVID-19 cases across the country. Now, moments ago, the Health Service confirmed 3 COVID-19 related deaths, with experts raising concerns that the country may not be able to contain the 4th wave, with vaccine hesitancy still a challenge in battling the COVID-19 pandemic. The Ghana Medical Association and the Ghana Registered Nurses and Midwifery Council is also concerned that the resurgence of the cases does not give a good signal in the country's fight against the pandemic. Well, I've been speaking to Dr. Justice Youngson, who is Vice President of the Ghana Medical Association.
What you just stated as some level of hesitancy in the community or the country called Ghana with regards to vaccine uptake is real. Based on some of the preliminary works done so far, there are clear indications as to some of the reasons why the vaccine hesitancy is actually a problem for us. It could span from religious beliefs and reasons through the fear of the unknown, misinformation, disinformation, propaganda, and what have you. But for us, we don't want to limit ourselves to these only. We want to get to the crux of the matter, and that is why we want to embark on this project, especially the research component. And the right place to start from is, as we say, from home. We are health workers, and we believe that health worker hesitancy is real. We don't want to just rely on the little information that we have gathered per some of the works we've done earlier, because we've seen that some people, for example, took the first dose, but they are reluctant to take the second, or may have taken the first 1 or 2 doses, but are reluctant to do the boosters. So clearly, even after the initial uptake, there may have been a change of mind, for which reason we need to get to the bottom and get all the reasons. So beyond the bits that I listed as some of the general things that we've all gathered, at the end of this project, most likely we would unearth a lot more of the reasons why this hesitancy still persists amongst health workers.
But the initial figures is staggering, about 40% as you're pointing to.
Yes, because like you're saying, some may have taken the first dose, but haven't taken the second or the booster. What it means is that, yes, at the first dose level, maybe the hesitancy wasn't that much, but at the second dose level and probably even the booster level, we are seeing some sort of hesitancy. So clearly, if you put all of it together, even though it's not an absolute figure, it tells you the amount of work we all need to put in. And it's most important that we deal with it at this time, because we are beginning to see surges in the number of cases that we have. And for us as health workers, we bear the brunt. I mean, if you take a small area like Korle-Bu, it's not a small area, but let's say a segment of the health sector. Korle-Bu, I'm sure recently we've all seen some of the statistics in terms of infected persons that came out through the public affairs unit of the hospital. That tells you that clearly we have some problems at hand. We are at risk because we are almost always the go-to persons when people are ill, for which reason we also stand the risk of getting infected in the process. So for us, we want to embark on this, make sure we get to the bottom of all the issues. It also helps us to put across the right kind of information to disabuse the minds of people who, for some reason, are getting hesitancy to go ahead in terms of what we all planned or we all hoped that the vaccines will do for us. Because if somebody has taken the first dose and is hesitant to take the second or the booster, clearly you need to identify the key reasons.
And it's indeed good that you're talking about the latest cases that we're hearing of. In fact, we are told that we have recorded our first 2 deaths after seeing the surge again. That also brings into mind the issue about the general public. What's the concern of the Ghana Medical Association and the message from your outfit to the general public on this?
Well, we have stated time and again that we all need to be very careful. And what that means is that, one, we need to stick to the preventive protocols. The wearing of masks, the use of sanitizers, soap, running water for hand washing, physical or social distancing. These are very key, especially where you find yourself in indoor places, work environments, cinemas, what have you. You need to protect yourself, because once the surge starts, we almost always know that that may be the beginnings of a wave. And with the wave comes all the problems like you're talking about. Before this current rise in numbers that we are seeing started, our levels were low, somewhere in the 40s, 20s, 30s. We didn't have people who were critically ill or severely ill, but suddenly we have them, and we are beginning to see the consequences. So, truth be told, there's a likelihood that this could be a mirror image of some of the previous waves we have had. But based on the experiences that we have all been able to gather, if we put our act together as a people and take hold of our lives through the preventive protocols as well as the vaccination, most likely we'll be in a better position by the time this current surge abates. Else, we all run the risk of perishing at some point.
Should we consider going back to some of the restrictive measures?
I think that these are very clear issues that we need to address. Yes, at some point, for economic activity and for our general lives to move on, when the numbers were such that as a state we thought they were okay or they were tolerable, we eased the restrictions. And that was happening in other countries because life has to go on. But just as it's been done elsewhere, the moment the cases begin to go up, you know that if you don't go back to the preventive protocols and adhere to them strictly, you run the risk of even collapsing your entire economy. For which reason, at this point, I will urge every single Ghanaian to go back to the protocols swiftly.
How about government? Because
yes, I'm coming to that. The state itself will also have to ensure that, look, we go to the old protocols that served us so well and prevent this current surge from getting to the levels that we had previously and from losing more lives. The fact that government relaxed the restrictions at some point does not mean that we cannot go back to same. And looking at the figures, it is time we begin to enforce the protocols at all levels. As they say, prevention is better than cure. We need to prevent ourselves from getting it, because our current economic situation will not even support huge numbers as we were able to do, let's say, somewhere in the year 2020. Because the expenditure on COVID, I don't have all the details, but it's huge.
Well, so time now to look at the figures and what it is that is happening across the country. Let's break that down for you in terms of the COVID-19 infections as we speak. For now, you can see that clearly we're dealing with some 1,311 active cases. If you look at the trajectory all the way from February of last year to where we are now, clearly there's an indication that the curve is beginning to rise again and rising up above the constant drop that we witnessed right from February to the early parts of March and then April that's this year. But then if you look at where we dropped from, somewhere around 1,876 cases, it appears that we are inching closer and closer to that gap again. So we're going back to where we started from. That's how the national picture is looking like. But we do know that the National COVID-19 Task Force is giving indications, which we'll get to very shortly. But in terms of the deaths as well, you see that the cases are going up again, just as we witnessed in March. So there you have it, 2 cases. But as of now, we're recording 3 new deaths as we're recording today. So that would definitely cumulatively add up to the cases that we have in terms of the national count, and then that is likely to further push the cases up. So the National COVID-19 Task Force is indicating that it is taking immediate measures and steps to scale up vaccinations across the country to deal with these cases. Well, Director of Health Promotion at the Ghana Health Service, Dr. Abuajida Costa, tells Joy News that people must get back to adhering to these protocols.
I've delivered about 16 million of the doses into people's arms, as I narrated from our dashboard. Now, the perspective of the GMA and the Nurses Association are that the under 25 seems to be leading the hesitancy score. So the question is, what is the Ghana Health Service doing? Now, what we are doing is that we will be targeting the schools and the universities. In fact, we have a program that we call YOLO. You only live once. We work with youth organizations, youth associations. So we're going to scale up this intervention to make sure that the youth are on board in getting the vaccines in their arms. Now, again, the GMA and the Nurses Association will be converting about 2,000 of their nurses and doctors and other healthcare professionals into health champions to address the hesitancy within the healthcare profession. And this, they will do it in collaboration with the Health Promotion Division. In fact, that is the whole essence of being here. But to the larger extent, we want Ghanaians to take the vaccines. So I think it calls that there is more work to be done, and we call on the media, other partners to support us in addressing this hesitancy. We really want to reach our population immunity target of 22.9 million. And I think it is important that everyone do play their role. Our approach for fighting this pandemic has been all society approach. So we mobilize, we get everyone on board. And it is this reason that I'm calling on everyone to make sure that the chiefs, our religious leaders, our various stakeholders, to make sure that they help us in creating demand for the vaccines. It will serve the interest of Ghana. We don't want to return to the old days when we were doing lockdowns, we were obviously being restricted in so many ways.
Already the Ghana Medical Association is advocating for that, calling for the return to the days of some of these protocols and restrictions. What's your take?
Okay, so thank you. Let me say, you see, I think for us, the protocols have actually not been lifted. You see, but maybe we need to communicate more prudently, or we need to put it very well. The fact is, we say that it is not mandatory. Mandatory is not to say we shouldn't wear it. We are only saying that, obviously, for open spaces, you do not have to, but we also, our statement was emphatic on enclosed areas. And if you look at the current data coming up from workplaces, from enclosed offices, you could see that we were on point to suggest that if you are in enclosed areas, you have to put on your face mask. And it is the same thing that we are advocating. So the face mask is crucial in reducing the infections, especially in this time that the infections have started going up. So I think it's the case of continuous education to the public, to explain it well, to let them know that the face mask, the hand washing, all the others are very important, and it's not the case that they should abandon those. Because in fact, the GMA, GRNA put it that aside the benefit that we have derived from the protocols in terms of COVID, we had others, like we have had reduction in cholera cases and diarrhea cases. So it means that we need to see how, as a country, we can institutionalize these protocols going forward.
None of them tops the issue of the vaccination. In fact, we're recording our first 2 deaths from this resurgence of the cases. What official reports do you have on some of these critical cases and the first 2 deaths that we've recorded?
Okay, so thank you. I think I'll take it from what the data is saying, as you rightly put. Now, we have a robust surveillance system that monitors some of that's why we are able to give continuous updates.
Well, fortunately, it's a good time now to have a conversation with the gentleman himself who's joining us via Zoom, Director of Health Promotion at the Ghana Health Service, Dr. Boajida Costa. We'll be talking to him shortly, but I have a host of others as well joining us. Dr. Christian O, the National Lead for Severe and Critically Ill Patients, the National COVID-19 Case Management Team, and also Dr. Titus Bayo. He's the General Secretary of the Ghana Medical Association. Let me start off with you, Dr. Bayo. You are all doctors now, so I must be careful. But Dr. Bayo, start off with us. The concern is that even some of your medical professionals are not willing to take the vaccine. So it goes then to the heart and the core of the concern that you have, that some persons, particularly even your members, are not willing to take the vaccines. Why?
Thank you for the opportunity, and good afternoon to everyone. Indeed, this is a concern to us, and we did emphasize that it is healthcare workers in general. We have doctors who are vaccine hesitant, we have nurses who are vaccine hesitant, and some other cadre of healthcare workers. And the exact reasons, some are apparent to others, others are not. To us, others are not. For instance, we know there are people who, for religious reasons, for misinformation, disinformation, for conspiracy theories, have various belief systems about these vaccines, and we've been trying to encourage people to take it. In the coming days, we would be releasing in detail the impact of COVID on us in a year, for the first 1 year, as we are approaching another, what looked like an obvious surge in the cases again. And for a year, when you look at the impact on doctors, it will be foolhardy for any doctor to decide not to take this vaccine. But we are not focusing only on doctors. We are looking at all other cadre of healthcare workers. And I think it is a generality of the population. But we are particularly concerned about healthcare workers because we are seen as role models. And people look up to us in our communities here and there. And so if we are not taking the vaccines, then how do we encourage others to take it? And we are perhaps the most vulnerable of people who could easily get this infection. And hence the importance of this collaboration that we have started, to educate the public, to educate our own members, to be champions in the communities, to help improve our vaccine uptake. Believe me, it is one of our surest tools in overcoming this pandemic.
Yes, but if the doctors are not taking the vaccines, then it appears that truly there may be some problems with the vaccine itself. Are we correct in putting across that suggestion?
No, I don't think it's that there is a problem with the vaccine itself. The doctors come from a population and they have their own belief system. Whatever you believe in the community, there are doctors who may also have that kind of belief. But the science and evidence we have as of today prove that this vaccine is very safe, and we are encouraging everybody to take it. You will recall that at some point, a group of doctors came up with a petition against the vaccine, and the association made our point very, very clear on it. Other members who are well versed in vaccinology also made the science and facts well known. But like any society, you would have one or two people who would have this kind of belief system, or have some belief in the various conspiracies and not want to take it. But to date, we do not have any serious concern for which reason we would want to take that, to say that no one should take the vaccine. The FDA regularly publishes any vaccine adverse events that are reported. They have a task force that is reviewing all the data. Until date, if you check their website and information they are putting out, we do not have any cause to think that the vaccine is not safe.
Well, very shortly, we'll be pointing to some of the initial findings you're getting from the report that's yet to be released. But Dr. O, the point is, and I don't have any scientific basis to back this, but you find many people, connecting to the issue of COVID-19 cases just as much as we wear our nose masks. When the president addressed us and told us not to wear them anymore, or to do so out of volition, the belief was that, well, it's a free time for us. We're free. We don't have the virus anymore.
All right. Good afternoon and thank you. And good afternoon to your audience. And my colleagues on the panel. Okay, so let me first of all correct a misrepresentation, because as Dr. Abajid Costa mentioned earlier on, information, education, advocacy are extremely important aspects of this, and the media plays a very massive role in that. So you just said that the president asked us not to wear the mask anymore, even before you added, or on our own volition. And that is communication.
I guess not exactly the same way I'm putting it, but the essence is you may wear it or not.
No, so I think that is my responsibility as it is yours, to make sure that misrepresentation of information, especially when it has to do with life-threatening pandemics like this, are done appropriately. They say, and that is what I say, that bad news is news. Good news, most of the time, nobody wants to broadcast out there. And in the last 3-4 months, you will bear with me that nothing in the media has happened in way of advocacy, both with respect to vaccine and the preventive protocols. So we all have a responsibility. And let me be quite very, very clear on that. And I'm not absorbing anybody, including the media, and more so the media, because you are the fourth estate. You set agenda of what is discussed. In most cases, even what we as health workers go out to speak about, if it does not fall in your agenda, in most cases may not get the platform to. So that responsibility lies with everybody, more so with you. Just as you're asking us about our role as doctors and role models when it comes to advocacy. And that takes responsibility with my colleagues on that we are role models. We are not just medical doctors, nurses, pharmacists, biomedical scientists. With respect to treating sick people, we also have the responsibility in preventive care, preventive medicine. And that is why we're saying that although among health workers, we actually have the highest proportion of vaccinated people in our country, which is actually around 60% or more. The average vaccination in the country is nowhere near that there in the general population. But we are saying that 60% is not enough. That, as you said, that it sends out the wrong message. If you have 40% of doctors, of nurses, of other health professionals who have not vaccinated. And I prefer to use data that are not just being subjective. So I remember very well similar discussions with the media during the fourth wave, where I presented what our data is showing with respect to those who are vaccinated and who are not vaccinated. So I'm going to reiterate that, because we have that data, and I'm not quoting data from outside our country, but locally generated data from the Ghana Infectious Disease Center, that we showed that those who are vaccinated and those who are not vaccinated still stand the risk of getting infected. In actual fact, in our OPD, of over 1,000 patients that had come by the middle of December last year, that about 39% of them were among those who had vaccinated, whereas 61% were unvaccinated. And these people who were vaccinated were both, whether single shot or fully vaccinated. At that point, we had not started booster. Now, that number still is similar as we speak now. Now, what is happening is this. When we looked at our ward, and we did present of those who are admitted with severe and critical disease, that 95% of them are among those who are not vaccinated. It was just 5% as against 39% of vaccinated people who found themselves in our admission with severe and critical disease. And the patients we had who died during that wave, all of them were vaccinated.
So your argument is that you are more susceptible if you do not vaccinate, or what's the point, Ben?
So the arguments have not really changed. And again, and that's why I want this to be very clear. Until a point that we are vaccinated enough to have a population that most people are vaccinated and have antibodies. And let's remember that the vaccines have their duration. So yes, we're getting people who fully vaccinated last year who have not had their booster. And from our information, just about 1% have had their booster who are getting infected again.
Right.
And we have reviewed those people, and most of them who are way more than 6 months since their full vaccination are losing their antibodies. Now, what we're saying is this, that until that point where almost the whole population are vaccinated, and where it means that then they can prevent the spread, that every one of us still stand a risk of getting infected, whether you're vaccinated or not vaccinated. That is as simple as it is. But those who are vaccinated then has a better chance of not getting severe disease.
That's a critical point that you're raising there. And I guess it's now time to explore the strategies with Dr. Da Costa to find out exactly what the task force will be doing to encourage more and more people to get on board, to get vaccinated. Dr. Abaji, what exactly should we be expecting from your outfit in the coming days?
Okay, so thank you so much, and greetings to my colleagues online. There are a number of interventions that we'll be rolling out, and a number of partnerships that we'll be forming. One of which we are doing with the GMA and the Nurses Association, where we are starting from our own health workers to make sure that they obviously get the right information, they get the right things to obviously become role models to not only their patients but to themselves. So it is a reason why the GMA will be transforming about 2,000 health workers in districts with low vaccination figures. I think it's about 25% in those districts. Now, not only that, from the data that was also presented, it suggested that the youths, those under 25, are hesitant to obviously take the vaccines. So our target will be in schools as well. In fact, I've seen some regions now linking up with the Ghana Education Service, scaling up vaccination in secondary schools. But I'll also add that for the health promotion, we have a program that we do. It's called You Only Live Once. And this is targeted at the university students and university students. So we'll also be using that program to complement what we are doing in the secondary schools. Now, as a country, we are using the National Immunization Days as a means to scaling up our vaccination exercise. We've realized that if we do 2 to 3 weeks active community engagement prior to the National Immunization Days, it will help uptake of the vaccines during those campaigns.
Right.
So that is what we will be doing. And I think that, we are linking up with churches, traditional authorities, and the media. So it's a case of also, as Dr. Owu said, the others also play their part. Like, what is the role of the traditional leaders in this vaccination exercise? What is the role of our church leaders in this vaccination exercise? What is the role of the media in our vaccination exercise? So once we are able to do all these, I'll put all these interventions together, you will see that it will come together for us to reach, obviously, our target of the 22.9 million eligible people that will
right. I'll come to the Ghana Medical Association, Dr. Titus Bayo, shortly for us to assess the strategy that you're putting out. But there's one outstanding issue even about the vaccination process, which has got to do with your database or the cards that you're issuing out. It appears that the first batch of persons who received the jabs are not too sure of the procedure. Some don't have the vaccination cards. We understand that there's no database on them. And so taking the boosters is becoming a challenge. How are you addressing some of these concerns as well?
Myself or
Dr. Da Costa, yes.
Okay, so, and the question is, sorry?
Yes, I was asking about the vaccination cards. Those who took the vaccination, the first batch. The believers that some of them are not captured in the database, so they're having difficulties taking the booster shots, and they are not too sure of how to go about the procedure in itself. What education do you have on that? Or do you have the database on such
This
persons?
comes to me as a surprise because I think we have some backlog which we have cleared. Now, if you have been vaccinated, we do this from the various centers. So all they have to do is to go to their various centers and their details will, because it's online, all they have to do is...
The problem is about tracking it. In fact, as we speak, there's an example in studio here talking about how they got the early vaccinations, but then they're not too sure if their details will be captured. Is that possible to find out? Just by walking to the center and mentioning my name, for instance, would that pop up?
Yes.
How do you go about it?
Yes, your name and date of birth is what they need in obviously retrieving your information. So I don't think there should be any problem on that. But if, for example, people are struggling, then I think what they will have to do is to link up with the COVID-19 helpline, which that's the one at the Government Information Center. That's a 321 and also I think 112. They will link them up to us and we will be able to help them. Because I know for sure that we have addressed some of those issues, but if there are people who are still in that category, then we will be able to help them.
Okay, so what you're doing now is that your platforms are available to such persons. Is that what you're doing?
Yes.
Okay, let's assess the issue of the 29 million target, and I'll start off with you, Dr. Titus Bay, on that. You've heard the plans laid out by the National COVID team task force. Pointing out clearly what it is they intend to do to reach that target. For the Ghana Medical Association, are there some more factors that we need to be on the lookout for in achieving that target?
So I think we need all partners on board. That is critical. We know that the attitude of people to these vaccines is much influenced by the knowledge that they have and what is being discussed in the media. If people are informed that we are in another wave or there's an imminent threat to their life, then they are willing to take the vaccines. If people think that the disease is gone, there's no point, then they are not going to queue up and take these jabs. From the point of the Medical Association, we are targeting districts where we have very low vaccine uptake rates. And we are going to go in there, again, relying on the media to partner us so we can use your platforms in local languages to try and educate and inform the people about these vaccines. We are going to go to churches, we are going to go to mosques, we are going to go to any gathering, the sports stadia where people gather, barbering shops where you can get the men. We want to use all these avenues to reach out to people and let them know that, look, it's not only about you, it's about our collective protection and survival as a nation. Do we really want to have the days of a lockdown again? I don't think so. Do we want to see news items about how people are being buried and they are struggling to get places and relatives are not given permission to access their bodies? I don't think so. So we want people to see the risk that this poses to all of us and the fact that their individual action can affect the entire community. And we are hopeful that, especially in these targeted areas, if the uptake goes up, it will help all of us. As you would know, a lot of people trust their doctors and their healthcare workers when they give them information. They will trust the media when they give them information. Typically, they will not like information and they will doubt information coming from politicians and things like that on this issue. I have on one platform trying to educate people, and I was surprised that someone said, oh, COVID money is getting finished, and that is why they've started increasing the figures so that we'll say COVID is back. and this is a belief that's so that politicians are deliberately increasing, but we are the healthcare workers. We are seeing the reality. We are seeing our colleagues. We are seeing people coming with non-specific symptoms. You ask them to do a test, and the COVID test comes positive. So if we go out there with this message, we believe that the people will believe us. they'll trust us and they'll key up and take up these vaccines. But our greatest partner is the media. This is our collective survival, and I think we must view it as such.
Just by the way, though, Dr. Da Costa, is the money finished, or you still have some left? Anyway, but let's touch on the reports that the Ghana Medical Association is yet to release. Just briefly, some of the indications that are striking in that report. We know it's not fully ready yet, but some indications that you're picking up. So we can all have a bite on that.
We reviewed our data in 1 year, and we're looking at 1 year of COVID from March 2020 when it first hit to March 2021, what the impact was on medical doctors. And we lost 9 doctors in the process. We had over 544 doctors infected. We look at doctors by grade and by place of work to see if you are a junior doctor, are you more exposed? If you're a senior doctor, are you more likely to die? Who is more exposed than who? What is your risk based on where you work? If you are working at an emergency or at the outpatient department or in the theaters and anesthetist, what is your risk? This is the kind of data that we looked at. And it will be published soon and we'll make it available. We hope that it will drive this vaccine campaign so that we all know that in this second or whatever, I think we have lost a bit of time as a country. The period where we're recording 0 cases was our best time to get everybody vaccinated. But typical of the Ghanaian, when there is no imminent threat to their life, we'll take things lightly and wait till we have seen that there is a serious threat. And now that, like my colleague Dr. Wu said, even then, nobody was discussing it. From the media to everybody, nobody was discussing COVID. So if you go tell somebody, take a vaccine, they're like, for what? Already we didn't want to take this vaccine, and now we are convinced that the disease is gone. Why should we take the vaccine? Maybe if it comes again, we will take it. Right. Now that we all know that the threat is real and we are seeing the dashboard and it's not pleasant, it is our hope that ordinary citizens will queue up and take these vaccines to protect all of us.
Let's bring in Dr. O then. I'm just interested in finding out what kind of or categories of persons you mostly deal with in terms of the critically ill patients. Has it got to do much more with age or depends on the variant that the person has been infected with?
So thank you once again. And that is the problem we're having and probably going to continue to have because the age keep dropping. During the very first 2 waves, we were acting even before vaccine came. The majority of people who were ending up in severe and critical centers were those who were elderly with multiple comorbidities. That has significantly changed. In the last 2 to 3 weeks in the Ghana Infectious Disease Center, we are steadily admitting patients who are severely ill with COVID-19. I've already admitted 2 today. And then another 2 yesterday. And for your information, I just finished reviewing just before this a 9-month-old baby who was seen in one of the municipal hospitals who had diarrhea, fever, treated for malaria, discharged home, and then come back 4 days later with not getting better. So the parents were cancelled, and then they had a COVID test done, and this 9-month-old baby is positive. The question is, are you? We were looking at saying that the kids were not getting infected, and remember that our age of vaccination still has not gotten to those children, and they are getting COVID. The university students are getting COVID. Those who I'm admitting here in the last 3 weeks, we've had a 14-year-old. We have multiples in their 20s and then multiples in their 30s. The funny thing or the ironic thing is that a good chunk of the elderly people with comorbid condition did vaccinate, and they are being spared. I discharged an 87-year-old woman just last week who from our ICU who has multiple medical conditions has vaccinated and actually was preparing to get her booster, was not feeling too fine and decided to test. And she was positive. She came in with severe disease and she was discharged in 5 days. She walked out of our center. Whereas I have 2 patients, and I'm in the center as we speak now, who are in their 50s, unvaccinated, and they are on their 17th day on admission, still on oxygen. We are hopeful that they will go home, but they did not need to be in hospital for 3 weeks if they had vaccinated. So yes, the age is dropping. Those who have comorbid conditions or chronic medical conditions are still at higher risk, but it is not just that.
So it's just it's mostly, I guess it's mostly about the vaccine. That's what's more paramount. Once you have it, you reduce the risk, I guess.
It is. Let me say something else, which is very clear. One of the things we said when the vaccine came on board was that vaccine is one of our protective or preventive protocols. So we keep mentioning preventive protocols and talking about hand washing, distancing, and then wearing our masks. It is time that in that same breath, we mention getting vaccinated and getting your booster when you are due to get your booster. And that is important aspect of this prevention, because if we get vaccinated significantly, we stand a better chance of beating this infection coming in waves. If we do not, I am not being a devil's advocate, but I can tell you clearly, because the science does not lie. We'll be back to discussing this again
anyway,
in 4 months' time.
And that's what we definitely want to prevent, Dr. O. Let's wrap up with you, Dr. Da Costa, your word to the general public and what to expect from your outfit in the coming days.
Okay, so thank you so much. I think from just this conversation from Dr. Bayo and Dr. O, clearly you can see that the unvaccinated population poses a risk not to themselves, but the whole country or everyone. So it is the reason why everyone must be vaccinated. You see, as for the Ghana Health Service, what we're going to do is those that I obviously told you. We're going to scale up the campaign on the vaccines to make sure that we get the vaccines on people's arms. And we're going to do this with partnerships with organizations like GMA, youth groups, and the media and others. We need the support of the general population, especially those who are not vaccinated, to go and get their vaccine. The vaccines are available at all government facilities. We have enough quantities in stock. So please and please again, Ghanaians, we are pleading with you for our collective good. Let us all go and get our jabs. We want you to have the first, second, and booster doses to protect us all. Thank you.
Thank you so much. That's Dr. Da Costa, Dr. Bayo, thank you, and Dr. O as well. We're grateful that you have all spent some time with us here on The Pulse.